Well, dear students, today we will discuss about general anesthetics. First of all, we will know definition. What is general anesthetics? General anesthetics are the agents or compounds or the drugs which produces reversible unconsciousness and unresponsiveness in person. So three things mainly we have to know. They produces reversible, not irreversible. Means after producing unconsciousness, again they will recover. Reversible unconsciousness. Unconsciousness, what is the meaning of unconsciousness? Unconsciousness means loss of awareness. They will not aware. They will become unconscious. And unresponsiveness. Unresponsiveness means they will not respond to the external stimuli. For example, if one person become unconscious and unresponsive, then if someone is touched, that will not respond. So if we concisely define what is general anesthetic, we can say that general anesthetics are the agents. General anesthetics are the agents or substances, or you can say are the compounds. Anything you can mention. General anesthetics are the agents which produces reversible unconsciousness and unresponsiveness in person. So this is the definition of general anesthetics. So we understood what is general anesthetics. Now what is the uses of general anesthetics? We all know the uses of general anesthetics are used mainly during surgery, major surgery, not the minor surgery. In case of major surgery operation, then general anesthetics are used. Now we will discuss about the classification. General anesthetics are mainly two types, which are inhalational anesthetics or maybe intravenous anesthetics. Inhalational anesthetics are given through the nose musk and they will go through our breathing. So intervenous are given as an injectable forms. In case of inhalational anesthetics, which may either in the gas or volatile liquid, which may be volatile liquid or gas. For example, gaseous anesthetics is nitrous oxide. And volatile liquids, some examples I have given: ether, halothane and fluorine. There are some advantage and disadvantage of these agents are there. For example, nitrous oxide, the most advantage is that they produce rapid action, very fast action they will produce, and they will not produce respiratory problems, irritation. But ether can cause respiratory irritation. So, and halothane and fluorine, they can damage the organ. So there are certain advantages and disadvantages of each type of gaseous anesthesia is there. In case of intravenous anesthesia, which are given as an injectable form, some are short acting, means those anesthesia drugs will produce immediate action. Immediately they will produce their action, and their action duration is very short time. That's why they are called short acting. They are mainly used as an inducing agent. They are mainly as a inducing agent. Example: thiopentone, propofol, methotrexate are the inducing agent or short acting inducing. They induces anesthesia. Long acting, the most commonly used long acting are benzodiazepams. Long acting means they produce longer duration of the action. Benzodiazepam examples: diazepam, lorazepam, midazolam are most commonly used. Opioids, which is a narcotic, analgesics and anesthetics. The most commonly used is fentanyl, and other are used as a ketamine. So this is the brief classification of general anesthetics. So again I am going to tell you two types of general anesthetics: inhalational anesthetics, which are given through the nose, and they are either gas, direct gas, example nitrous oxide, or which are maybe volatile liquid, who are liquid they remain, but while giving at a atmospheric pressure they will become vapor, volatile: ether, halogen and fluorine. Injectable are thiopentone, propofol, methotrexate, which are short acting or inducing agent. Longer acting or slow action are benzodiazepam like diazepam, lorazepam, midazolam, opioid, fentanyl, and other are ketamine. This is about the classification of general anesthetics. Next we will discuss about mechanism of action of general anesthetics. Mechanism of action, very important thing to know. General anesthesia produces unconsciousness, means they decrease the neuronal activity, the activity of brain, central nervous system, they will decrease. So mainly what happen in case of inhalational anesthesia, it is the alveoli, and this is the blood, and then it will go to brain. So when inhalational anesthesia are given through the nose, then some concentration will require, and they are highly lipid soluble, so easily they can cross from alveoli to blood, and they will reach full blood, and from that blood they will reach to brain. So this is called MAC, minimum alveolar concentration, which defines the strength of general anesthesia. Minimum alveolar concentration is the amount of the concentration of the general anesthesia which is required to produce unconsciousness in 50% population. Minimum alveolar concentration. Now we understood that from the lungs, alveoli, the general anesthesia will reach to the blood, and then it will reach to the brain, and again when the general anesthesia is not applied, then they will become again returned from brain, they will reach to blood, and through the lungs again they will release out due to the partial pressure difference. Now how they produce the action in the brain? Suppose this is a neuron in the brain. In the neuron there are some potassium channel are there. What happen? Normally potassium ions remain more inside the neuron, and they activate, general anesthesia activate the potassium channel, activate, and then more number of potassium ions will remove from the cell. Also the sodium ion remain outside of the neurons, are more concentration, and they block sodium channel. This is the sodium channel and this is the potassium channel. Also they disrupt the membrane lipid. So inhalational anesthesia mainly work through three mechanisms. One, by activation of potassium channel, activation of potassium channel. Number two, blocking sodium channel, and number three, disruption of membrane lipids. And by these three mechanisms they decreases neuronal activity. and action potential like current of the neurons will decrease and person will become unconscious. This is the mechanism of inhalational anesthesia. Now we will discuss about the mechanism of intravenous anesthesia. So first of all, before going to that, again I am repeating this one. First we are giving that general inhalational anesthesia through our nose or mouth. Through the nose they will go to the lungs, alveoli of the lungs. From the lungs they will reach to the blood and then they will reach to the brain based on the partial pressure, difference in partial pressure. And when they will reach to the brain, they will activate potassium channel. Then potassium ion will move from neuron to the outside. They will block the sodium ion channel. By sodium ion entry will block and they disrupt the membrane and then losing of the so many ions from the cells, and finally there will be the decrease in the neuronal activity. This is the mechanism of inhalational general anesthesia. Now we will discuss the mechanism of intervenous injectable anesthesia, mainly benzodiazepines. Suppose this is the membrane, in the neuronal membrane, this is the neuronal membrane. That membrane having some pentameric structures, and in the middle there is a channel is there which is called Cl channel. That channel normally remain closed. When GABA, this is called GABA neurotransmitter will bind, normally then channel will open and the Cl minus chloride Cl minus will enter inside the cell and the neuronal action potential will decrease and it become repolarized. So this is normal happen by through this, and this is called GABA receptor. GABA receptor. Through that GABA receptor is chloride ion channel receptor. When a GABA will bind, then the opening of that, in the middle opening of the channel will take place and chlorine ion will enter and neuronal activity will decrease. Most of the benzodiazepines, barbiturates, whatever intravenous anesthesia, they will bind with this GABA receptor. They will bind with, which are mainly agonist of GABA, means they will bind to that different side and they open the channel, and when the channel will open, similarly the chloride ions will enter inside the cell and inside the neuron. And after entering the chloride ion inside the neuron, neuronal activity will decrease because Cl minus is negatively charged, so action potential voltage of the neuron will decrease and person will become unconscious. This is the mechanism of benzodiazepine. So like different other mechanisms also there for other anesthesia. Now we will discuss what are the side effects of general anesthesia. During anesthesia process, the person will suffer respiratory depression, fall in BP, salivation, cardiac arrhythmia. These are the commonly seen side effects or adverse side effects during anesthesia. After anesthesia, when person will recover, then the person will suffer from nausea, tendency of vomiting, that which is called nausea, vomiting, sedation, person will sleepy type tendency, sedation, and organ damage like kidney, liver damage may happen, and cognitive defect. Person will find difficult in the recognition, which we are seen most commonly. So these are about the side effects of